I just want to welcome you to my neck pain, a real pain in the neck. So I know a lot of you are here for some reason that you know somebody or you have some discomfort in your neck. So we'll be going over hopefully a lot of stuff that you will understand tonight and understand why you have neck pain and what you can do to improve that. Okay. As my boss did a great intro, which made me a little blush a little bit, so I appreciate that very much. I'm Gina Driscoll. Been working about 25, 26 years in the business, and I would do it all again. I love what I do. I've been in Franklin. I love working for Milford Regional. I'm one of 7 in this clinic, and we all work necks. So you're all in good hands here. And there's also 2 other clinics in Whitensville and Milford who also treat necks. Okay, so there's 3 different areas that Milford Regional works out of. Okay, as you said, I'm a Husky. I'm a Northeastern fan. Okay, and I have 1 daughter going there now. Not PT though, but we wished a little bit. Okay. So these are some things I'm going to go over. I know some of you are going to freak out when I say anatomy. I'm going to go over that. There is no quiz at the end of this. It's just to get you, to educate you, to have some knowledge about your neck. Okay. So we're going to go over the anatomy of this C-spine, just enough for you to understand. I'm not going to go in depth. I'm going to go into general. Okay? And once you find out about your anatomy, you're going to find out why you have certain pain, and I'm going to go over that. Okay? Some symptoms. I'm going to go over the dysfunction, what the symptoms are, what you feel, what's going on in those symptoms. Okay? Daily living, most important thing. What are you doing every day to cause this pain? What can I do to change that pain that I'm doing? Very important. Posture and body mechanics, big one. I will be talking about this the whole night long. It's the most important thing. All right, I see you all kind of moving in your seat a little bit. So you know what I'm talking about. You will be understanding good posture by the end of this 1 hour. Okay? So very important that you understand that. I'm going to go into injuries of the spine a little bit and some dysfunctions there of the spine. Okay? To have you have some knowledge in that. First one is what I'm going to do the anatomy. I'm going to go over when I say neck or cervical, I mean the same thing. I'm just kind of always saying cervical, but cervical is equivalent to saying neck. So I apologize in the slide that says cervical because I'm just in that mode, but they are equivalent. Neck and cervical mean the same thing. Just want to have you understand that. I'm going to go over the vertebrae itself. I'm going to go over the disc in the vertebrae, which you probably all heard about. The ligament, muscles, and nerves. So we're going to cover all that as, again, a basic understanding with no quiz at the end. Okay? Most important about it is the vertebrae, which are going to be those 7 bones of the neck. Okay? These bones are basically what we stacked on top of each other, and they're the framework of the neck. Okay? They're the columns on top, make the length of our neck. Oh, what did I do? Don't know computers at all? I'm going to step back a little bit. Okay. So we have 7 of these. As you can see here, 1, 2, 3, 4, 5, 6, 7 make up the cervical spine. Okay. These bones, okay, as you can see from my spine here, these 7 bones have a C, kind of a C action going on here. Okay, like a little C. We also have the thoracic area where your ribs are attached. There's 12 of those. All right, and they make a reverse C going here, and then the lumbar make a never C. Okay? This is very important to have this little S shape that we have in our spine because our neck is going to sit on top, these 7 here. So you need to have a good balance between all these vertebrae or the bones on top of each other. Okay? It's kind of like if you're walking and when you take a step. Okay? If we have this nice S shape, the pressure of every step we take will go up from the bottom of our spine all the way up to our neck. Okay? Important, because sometimes we take a step and someone's grabbing their neck. Okay? Some of these I'm going to go over later in the dysfunction. Okay? So that S shape makes it equal all the way through. Okay? Okay. The vertebral joint, okay, is going to be where most of our movement is in our neck. Some of us have too much, some of us don't have enough, most of us don't have enough. Okay? The neck has a joint, which is going to be what we call the articular process. I don't have to go into the full name of it. But if you look right here in this kind of area of your neck, Okay? So if you're looking from the side view, it's going to be here. So the joint is always going to be something where movement occurs. This is my shoulder joint. I can move this joint all the way around. It's big. I have a ball and a socket. So we all know that. It moves pretty good. Okay? My hip joint also has a ball, bigger socket, because it's mostly support. Okay? I'm putting a lot of weight on my hips. Okay? Neck isn't anything like a ball and socket. Our elbows have a hinge joint, move a lot of movement. Okay? The cervical spine area is kind of like your palm of your hand and another palm on top. Okay? We call this a gliding motion. In order for our neck to move, we're going to glide forward on the top bone, backwards on the bottom bone. Okay? So it's like a slide, or we call a glide. Okay? There's going to be 6 motions. It's going to be looking down, looking up, looking to your right, looking to your left, side bend, and side bend. Okay? All these bones, as you can tell, the gliding motion, it's a small joint. Okay? But when you have all 7 of those joints moving together in sequence, it makes a good movement. Okay? So each bone on top of each other has 2 facet joints, or just joints on the side that occur. Okay? This is going to be important later when we have a cervical dysfunction in that area. Okay? So it's a gliding movement. Okay? So you can see here, these are the joints on this side. Can you see that space right there? So when I go to bend forward, that whole joint's going to move, that joint's going to move, and that joint's going to move. Okay? We know this front part now is that vertebral body I told you about, the bony area, and this is going to be the joint. Okay? So really important. So when one moves, the next one moves, and then we can move our whole neck in that motion. Okay? All right, so here's our 1, 2, 3, 4, 5, 6, 7. Okay? All right. Our next side is ligaments. Okay? Ligaments, we all know more from a sporting event. If we have somebody that, or a basketball player that tore his ACL, or Brady that tore his ACL, a pitcher that tore their ligament in their elbow. We see this all the time. You don't hear it as much in the neck area. Certain areas we do. We'll talk about those later. But ligaments are all very important because they're a strong band of tissue. Okay? It's going to be a nice strong area, almost like a can top a little bit, that holds our beer bottles or our beer cans or our soda cans together. And it gives us a little bit more stability in our body. Okay? So when we look at a little bit of a ligament, okay, what's interesting in the neck, this is a ligament right here. It's going to be that band of connective tissue that bring bone together to give it a little bit support. Okay? We have them in the back, a lot bigger. In the back of our neck, smaller in the front, really wide in the back. Okay? Giving us some support to keep our head up. Okay? Like a ligament, it does give a little bit when we move. It has to. Okay? And then goes back to its regular position. Okay? You guys, I know this is going to be gross, but if you look at a chicken, chickens are great to dissect. Because if you take a roaster, you kind of take the wing off, or you take off the drumstick, you see that little white thing hanging? You know? Stop playing with that. That's a ligament. That's like a soft tissue. You can feel it a little bit. It has a little bit of give to it. Okay? So that's good. We want our bodies to give, but we also want to support in that area. My next section is the disc. Okay? It's a fluid-filled sac. Okay? The disc itself is very important because it's like a cushion for us. Okay? It's like equivalent to the brake pads in your car, gives you a little cushion when you're moving. Okay? When I like to look at the disc, I talk about a lot of the disc because it's where a lot of our changes happen older in life. A lot of injuries when they come to us is disc involvement. Okay? So the disc itself sits between these 2 bones, those vertebrae bones that I told you about earlier. Okay? It sits right in here. Okay? I kind of like to look at it as a big balloon. Okay? I like the balloon scenario because if I have the bone on top and the bone on the bottom, I've got some good support in there. And that's what our disc looks like. It has an outer casing, which is going to be right here. Okay? A little bit of annulus. And then inside it has what we call a jelly, which is the nucleus pulposus, okay? What I like to call it, as we say in the scientists, a jelly donut, all right? So you always have something holding that disc in, all right? You have the framework for it, and then inside, it's not air, it's going to be like a jelly-filled area, okay? So it's definitely equivalent to that, okay? So when I take a step, so now you know I have that S-shaped posture because I'm perfect, like you all are, okay? So when I take a step, and in between, you saw that S shape that's happening, I have those discs. So it's absorbing some of that pressure with each step as I'm walking, okay? So that's your disc. Very important. It's going to come up a lot later today in this lecture, okay? So it has an outside casing, and inside is going to be that jelly, okay? Its main goal is a lot of shock absorbing. Okay. The next area I really like, because this is where I come in, okay, is muscles. We all have muscles. Some are small, some are big, built up a little bit more than others, okay? Muscles important, okay, because this is something that you guys can change. You can be in control of. You can get these muscles stronger. You can get them stretched out. So these I like to really talk about a little bit because it's something you can make a change in your life if you do have some neck dysfunction, okay? All right, so we have superficial fibers, okay, which you can see on us. They're all in the front type of thing. And then we have the ones that are a little bit deeper in us. So if we take off this tissue right here, connective tissue, we'll see deeper muscles, okay? Muscles are what allow us to move. They're controlling our movement, okay? And how they make us move is you can actually see these fibers. Again, if you dissect that chicken, you can see where you cut. You're better with the grain, not with the grain, that kind of thing. You can kind of look at that a little bit because each muscle goes in a different direction. You can see this one goes from chin over. These are different going in this angle. Well, I might pull my scapula up a little bit. This one's going to pull my mouth down. This is going to make me rotate because it's kind of at an angle, okay? So that's where we want you to learn a little bit about that, okay? Muscles work, so these are fibers. You can see the fibers that are in the muscles. But how they work, okay, is you have your muscle fibers, and this is very general, so don't bring it up at Harvard or anywhere, because I'm just making it really simple for you guys, is how they move is they are shortening of the muscle and a lengthening of the muscle, okay? So if you think about that, okay, if you're sitting in the same position all the time, you're going to get a little tight on one side and a little stretched out on the other side. And I'm going to go over that in the posture lecture of education, okay? So with shortening on one, if I'm saying I have my neck, okay, and I want to see Poppy's fly ball, that guy should have dropped out in the field, but that's another thing. I'm going to look to my right? So I'm going to shorten these muscles. Now you know the muscles kind of shorten together. They're going to shorten on one side, all right? So when they shorten, on the other side, I have to lengthen. So always on one side of a joint, a muscle's going to contract, and on the other side, they're going to lengthen, okay? And we're going to go over that again on what's wrong and what's not happening with that. Okay. Again, a chicken is excellent to look at. Okay. Nerves. Okay. Nerves are pretty interesting. Okay. If you look at these nerves, okay, they're basically what I call the wiring of your brain. Okay. So they're the ones that tell your brain what I need to do, and then they're attached to the area they're going to make connect. Okay, like the muscles itself. So it's the channeling connecting the brain to the nerves, to the muscle action. So every time I turn my head to the right, I don't have to think, I need to contract this muscle and that muscle to turn to the right. You don't have to think about that. Your nerves automatically do it. They're going to tell you that this muscle needs to contract for me to look to the right and this one needs to lengthen. Okay? The nerve itself comes from the back of your head, from your brain, down to your spinal cord. So this is like the main branch right here. I like to call that the trunk of the tree, solid, okay? Then off of those, as you can see, there's little branches that come out, okay? And these are the cervical spine, okay? They're going to come out between each of those vertebrae that we listed, the 1, the 2, the 3, all the way down to 7. They're going to come out between those, okay? And this is important for different things that I'm going to talk about in cervical dysfunction. I'm going to come back to this slide to say, remember that slide where we had the tree trunk and then the branches coming out, okay? Now the middle branch, we know a lot of involvement, okay, which I'm not going to talk too much about, is we know where if it's cut in this main trunk area, that's where you hear of your quadriplegics, or lower down will be your paraplegics. So I'm really not going to talk about that. I'm going to be talking about these areas that come out in between the vertebrae, in between the disc, and the facet joint that we talked about earlier in the anatomy. Okay. It's important. Okay. What the nerves do, okay, they tell us a nerve pattern. Okay? This is really good when you go to the doctor's office. This is why we always want to know, if you go to see us, we want to know your symptoms. There's no stupid symptom. There's no something I'm not going to tell my doctor till later. Okay? And I'm going to go over that a little bit. You always want to feel what's going on. Okay? The nerve pattern is very important because you could have at C3, which we know is the cervical 3, okay? All right, it's going to give you a certain pain pattern, as I call that referred pattern. That mapping where that nerve pain is going to be is what some of them call it, okay? So if I come down and I can see, wow, I got pain in my elbow and my hand, why is, you know, that's coming from C5, my C6 that you know now are in your neck, okay? So not all neck pain is in your neck. It could be down, burning down your arm, okay, some weakness in your arm. And you're all shaking your head, yeah, I got that. All right, and we're going to go over that a little bit why later on, okay? So the mapping is important. The green part is the cervical part, and we're always standing like this, okay? Anything science-wise, we're in this position, okay? So that's where the green is cervical. That's, they just make a different color, okay? So pain, pattern, pain is a liar. Okay. So I went over the anatomy. You all weren't freaking out, so that's a good thing. Okay. So now we're going to move on to our next. Okay. Half of you look like this right now. You're all sitting there. You're all moving around. Okay. So I just have to talk about this a little bit because I've been doing this for 25, 26 years, and I do want to say the age people that we see this at now is way younger than we used to see, okay? And I think modern technology is one of the reasons I wanted this course, that more people are having neck pain, is because of our iPad, our smartphones, you know what I mean, our Kindles, okay, Xbox, sitting at a computer, you know, at work for 10 hours, and you go home and play Candy Crush for another 2 hours, okay? A lot of posture involved in there, a lot of things that's going on, okay? So we definitely need to talk about cervical dysfunction, okay? I will say I'm getting, and I think the therapists in the back will agree, we're definitely seeing a lot younger people. I'm seeing 10 and 11-year-olds with headaches because of posture, so that's really sad. I think that's sad. I think they should be outside playing. I never had a PlayStation at my house, okay? Posture and balance, okay? What did I say I was going to talk about the most? Posture and balance, okay? The guy in the middle is how we all want you to be. You come to us, we'll be screaming at you till you become this, okay? Our head sits here on top. We have this line coming down through. Very important, that line. We want to be upright, all right? I want to see that S curve in my spine, all right? All right? I'm going to do a little thing with all of you right now, because this is what we all look like, sitting here. If you all can see yourself, this is all you. I'm not seeing too many of these in the audience. I'm definitely seeing a lot of these. I just want to just show you something. I want you all to lean forward. I want you to roll your shoulders in, bring your head in. I want you to take a breath. All right? If I'm taking a breath, look at me. I'm taking a breath. My shoulders are going up. I'm not getting a good breath, am I? Are you guys getting a good breath? No. I want you to be up nice and tall. I want you to bring your shoulders back a little bit. I want you to take a big breath. Are your shoulders working? Your shoulders moving? No, right? You're using just your diaphragm. Your lungs are expanding. You're pushing your diaphragm out, and your belly comes out a little bit. That's normal, guys. Everyone's here. They're all breathing just from up above, and that ends up being you end up exhausted by the end of the day. You know, you do this 12 times a minute. It's a lot in an hour. It's a lot in a day. So it just adds extra pressure to your neck. Okay? The other thing about this posture, poor posture number 1, okay? You can see he's got a little what we call a kyphosis, all right? So he's rounded here more than he should be, okay? And then he's rounded here more. Knees are bent, end up having some knee pain. So the posture is really important all through here, okay? The other thing is gravity. Gravities keep us on Earth, right? What keeps us here, we're not floating around. So when when my head's in this position, my gravity's hitting me here, right? And then I got to keep my head up. If I'm here, gravity's here, and I get that pressure. I don't have any of that extreme muscle fatigue by the end of the day, okay? This is why I said posture, I bring it up a lot. It's really important, okay? So really important to be upright, and we'll talk about this a little bit, okay? This area here, on this side, okay? This one you can see. This is me at the computer. This is me with my smartphone. This is me with my PC. And then we have the PC people, and then we have bifocals, right? And then now, where does my muscles in the back of my neck doing? What's this? Contracting? Getting tight. They're not resting at all. They're always in position of this, right? You know who this is. All right, so we'll talk about that a lot in a little bit later on. Okay, type of thing. So, this is you, right? Are you Nanny? Is this you? All right, and this is here. Good posture. You want to maintain that S curve. You want to be upright. You want to be in position. Okay. I tend to use my little bricks here to show people. I don't know. I'm very Italian and I love architecture, so I think I may have a little thing to go with bricks. But posture is, if your spine is not in good position, you know, some people come to us and we have to work on their core. You know, if your abdomen isn't working right, or your hips are too tight, it's going to pull you forward. How many of you have made a wall? Made a wall, right? If the bottom brick's not right, is your wall going to be right? Same thing with your body. If your bottom brick is a little bit crooked, where am I going to be? Where's my head going to be? My head's going to be real forward. Then I'm going to end up with gravity hitting me here. Then I got to look up, and I'm going to be tight back here, and I'm going to be burning down here. Okay? So really important to think of not just your neck, to look at your back a little bit to see what's happening in there. Okay. All right. Okay. Over some of the symptoms. I'm way ahead of myself here, but some of the symptoms: poor posture, headaches. Again, going back where those muscles connect in the back of your neck. How many of you rub back here? You're rubbing back here. These get really tight. You get a little pain coming out the middle of your eye because these are tight. You're putting in this position. Okay? So a lot of muscle aches in the shoulder. Okay? You're tight in the pecs, you know, type of thing. Women or girls who are a little chestier than others tend to hide them. They don't want anybody to know they have them. They're tight in this area. They end up getting a lot of headaches and back pain. Okay? Muscle burning pain, upper, we'll go over that. Why? That nerve's being irritated. Okay, you know where that nerve is now. That's why we had to do anatomy. And decreased posture in the back. Okay, so if I'm sitting, here's my nice little S curve, right? But if I'm sitting straight, what am I doing? I'm straightening out your spine. Okay, and then we're going to talk about that in a little while. But the more you straighten the spine, the less that space is where that disc is, the balloon, where that balloon is between those two joints, it's going to be smaller, okay, because you're straightening out your spine. How many people you see walking down, you will now, walking down the street, their head's really straight. They're moving like this, okay? It's not half of you. I watched you as you came in. Okay. I'm going to back up for one little thing. Posture changes don't take a lot. You don't have to buy anything. Towels are great. You're driving in a car, you just take a towel. Just let your wife know you took it, because we're always looking for them because we match a little bit. You just roll up a towel, put elastic in it. If I have this in the back of my back, I'm going to be correct. Remember the bottom brick? You know, I'm going to put this back behind me, my head's going to be right. Without this, I'm like this. I put this, I come up. Makes a difference. You don't have to buy anything. Just need a towel. We all have towels. Okay? The other thing, sleeping. Okay? Take another towel. Okay? How many people have nice flat towels like this? And what you're doing, you're shoving it up your neck, right? You're rolling it up, you put it in underneath your neck. You just roll up a towel, put it in the bottom of the pillow. Costs you nothing. Doesn't work, you take it out. Gina was wrong. All right? And I got to roll. Why do I need a roll? Remember that C curve we talked about in an anatomy lecture? I need something to take up that space in my neck when I'm lying down, or then when I'm lying on my back. If you're lying and the pillow's like this, there's no rest here in these muscles, right? Right? There's no rest. okay? Or you can take a little, this is my pillow. My friend made my pillowcase. And then if you feel that that works, then you want to spend maybe $20, $30. You can get, these are cervical pillows, okay? This one's very loved by me. All right, little Tempur-Pedic pillow, bought it at Kohl's, no big deal. I laid on about 3 of them, saw which one fit my neck, and it already has the roll in it, okay? So again, it's taking up that space on my neck, okay? Take a little to get used to, you know what I mean? But tonight when you go home, the weekend, maybe put it in, try it, see how you feel. If you wake up really stiff in the morning, it takes a couple days to get used to a little bit. All right, now we're going to go into a little bit of the cervical dysfunction, which you're all going to try to analyze yourself tonight, aren't you? Oh, yeah. Okay, so it's where a doctor comes in handy, but these are just, again, basic things, okay? I'm just trying to educate you because the more you know, the more you'll know why you need to do certain things and change your life, right? So this is cervical, okay? Don't be scared by these big names. Degenerative disc disease is the first one I'm going to talk about. Remember I said that word disc was going to come up a lot when I talked about dysfunction? Okay. So degenerative disc disease, another name for that, arthritis. Okay. It always pops up somewhere. Okay. Degenerative disc disease is going to be, remember these 2 bones? The big bone, the vertebral body that we talked about? Here's my disc. That's my balloon. Okay. Or my hamburger between my 2 buns. Here's my disc here, a little bit thinner here. Do you see that? So we go from this, we're born, nice and thick. I got a nice big space between my bone on top and my bone down the bottom. I got plenty of place to shock absorb. My joint has plenty of room, and this is my nerve coming out. I'm not pinching on anything, okay? Then time goes on, we get a little smaller. Time goes on, we get a little smaller. What can cause? Okay? So what happens now, we can see where this is, okay? This disc is smaller. What's going to happen to that joint we talked about? It's going to be smaller. You're going to be more bone on bone. Okay? When you have more bone on bone, that space where that nerve comes out, we'll talk about that later, is going to be involved in that too. Okay? I would say probably more than half the people have smaller disc and disc degenerative going on right now just because we're all a little older. I don't see any 10-year-olds in here. Okay? All right. So symptoms. In PT and in an office, you know, we go by symptoms a lot. We go by what you guys tell us, so it's really important. We don't have x-rays, we don't have MRIs, but we need to know what your symptoms are, okay? People on 40 will have this, but they have no symptoms. People over 40, definitely 50, more in the 60s, have this, okay? And they'll be able to tell you. This will be stiffness. You wake up, you're stiff, take a hot shower, you feel a little better, all right? Lose a lot of range of motion. Okay, and that's where we come in. We don't want you to lose that range. We need that fluid of that muscle. We need the fluidus of that joint going on a little bit. Okay, so that's going to be the smaller disc on that articular process. Okay, I know most of you have felt this a little bit too. When you kind of turn your head real quick and you go, whoa, what was that? You feel that shock, right? You've felt that before. You kind of turn, you're a little bit hot, you feel a little burny, you kind of grab there a little bit. Kind of takes your breath away a little bit. Okay, so you've all felt some kind of that a little bit. But some of us can get over that. A couple of days later, we're moving fine. Okay? As we get older, our head comes forward, we can't move as much. Okay? Then we kind of hit in that articular process, and we're having a little bit more symptoms of this. Okay? All right. Big one. Okay? Cervical radicular pain, cervical referred pain. Remember that? Oops. Remember that lovely little chart I showed you with the green? Kind of going down where that pain is, what's going on in there, okay? That's where the nerve root at one level is being affected, okay? So we're going to feel, this is the spine. Remember we talked about the big spine in the middle and the branches coming out, the tree trunk, right? It's coming through here, we have the nerves coming out between the discs. The next slide will show us a little bit better. And referred pain, that green that we talked about before, where that pain goes down, okay? The pain will spread upper neck, down the elbow, down to the hand. Okay? And by what you tell us, where you say it is, we kind of know what nerve it is. If you tell me it's down here, I know it's going to be like a C6. If it's up here, C5 or something like that. You don't need to know that. You just need to tell us that information in your doctor. Okay? Some of you have experienced that a little bit, I think. If you hit your elbow and you get the pain down these 2 fingers, Kind of referred, that's like a referred pain. It's a burny pain. It's not a very comfortable pain. Okay? All right. Now we're going to cervical radicular pain, which is the referred pain. There's two different types. We have bulging disc and we have herniated disc. And I know you all have heard this. Right now, a lot of people have bulging disc. You just don't have symptoms of them, which is good. Okay? I'm sure I have 3 or 4 of them. Okay? Most are asymptomatic. Okay? So what happened with the bulging disc is what I'm going to go over first. Okay? Is we have the disc down here. Okay? Remember the jelly donut that we talked about? My balloon? All right? So here we have that outside of that balloon, and everything is intact. Okay? Jelly's a little thinner. It's coming out a little bit, but it's not out beyond that little bit of fiber that we talked about before. Okay? As we get more into it, it's kind of pushing out. Okay? The next slide will show us a little bit more of what it's pushing out into, okay, on the bulging disc. Okay? And then here we have our herniated disc. It ripped right through those fibers, and that jelly is coming right out of that donut. There's no more air. It's coming right out. Okay? Where it comes out is important, too. Okay? So this shows you a little bit better. Okay? So here we have, remember there's our vertebrae. Remember our bone? Here's our articular joint, you know, that where they glide back and forth a little bit. And here's our disc in the middle. This is kind of looking at me, cutting me in half, and looking down in me. Okay? So here I am in the middle of that bone. There's going to be disc here, the joint here, those little branches coming out. Okay? So that's the angle of it. It's just good because it's showing you, here's my balloon. Here's my jelly donut. See how close that is to that nerve? Here's the trunk. Here's the bundle of nerve. When this comes out, in the second slide, if it comes out just a little bit, it's not going to touch the nerve. It may touch the nerve, and then you feel better with some medicine or something. But when it comes all the way out, I'm going to have a lot of swelling. It's going to be pinching right on that nerve. And that's when you get the burning pain down the arm. You just can't stand it anymore. You just want your arm is just really in a lot of pain. It's a lot of pressure. It's not a very big space. Okay? Not a lot of space. It's very small. Now you add bad posture, and then you add some of that degenerative disc disease. You're down, you shrunk that disc down, and you're going to be sitting a lot more right on that nerve. So here you are. Here's the nerve coming out. I'm sitting on that nerve. I'm going to bulge out into it. Okay? So it makes that space that's small a little bit smaller. Okay. Not good. Okay. Some of these. Okay. Herniated disc, what I like to say too is, I always say to my patients, because I think if you see what happens, I always use the hamburger thing. I'm into food and chicken, and I love to eat. I don't know. I do love to eat. But when you bite in, you have a regular burger, and you got your lettuce, and you got your tomato in there, and you take a bite of the front. Where does the patty go? Out the back. It's exactly what happens in a disc. We bend forward, the disc is going to go out back. We have a lot of bone in our back. When you feel the back of your neck, we have a lot of bony area. The disc is always going to typically go to one side. Okay? It's going to go to one side or the other, so it's going to affect a nerve on one side or the other side. So here's my burger. I bend forward, I do something, I'm going to hit that nerve. That disc is going to, all that fluid's going to come out onto that nerve. Okay? So a lot of the symptoms are going to be depending on the location of the nerve. Again, if it's up higher, you're going to have pain in this area. If it's around C5, this area 6, 7, it's going to be different. Some people just have it in their hand, you know, different. And don't be surprised. We've seen people, right, guys? So we come in, and they're on their right side. They have a little problem with their disc, and they come in 2 weeks later, it's on the other side. It will shift over. So that's not unusual to happen at all. Okay. Some causes. Do you think posture is going to be in here? Yeah, of course. Okay. Wear and tear. Usually these things don't happen like for one time. You'll have like some neck pain, it goes away. A couple years later, you get a little more neck pain. Doesn't go away as quickly. You know, and a year later, you get more neck pain. So it's usually wear and tear in your body. You know what I mean? Posture is the second one. Okay. What can I say about posture? Everything. You're making that disc push out. You're shortening it. Okay, you're forcing that disc to get smaller. Okay? Back of the head. How many people, you're in the refrigerator and one of your kids open up the freezers and come up and bang your head? I mean, you're doing some injury or some trauma to your neck, okay? Whiplash is another thing. I'm going to go over that in a second, okay? So it could be something simple. It doesn't have to be something hard, okay? Okay. Whiplash, okay? We've all had whiplash at some point or the other, okay? Nowadays, we're seeing more of this. Why are we seeing more of this? Everyone's on their phone, you know? Yep, they're all talking on their phone, they're banging into people, huh? We see more, I would definitely say, and I think my colleagues will agree with me, that I definitely see more whiplash than I've ever seen. I've seen 3 people come in, hit from behind, person on the phone, person doesn't get off the phone, gets out of the car, talking, and gives the person their license or their information. Could you imagine? I'd be freaking and I'd be screaming about that. But they're like, get off the phone, you just hit me, okay? So this is something I know that they're trying to fix, you know, a little bit. They're trying to get people, and you guys are here. You care about your bodies. So I know you're not the ones talking on the phone. It's the other ones that are talking on the phone that aren't here tonight, okay? So definitely a whiplash type of injury is somebody coming, doesn't even have to be a high speed. I mean, we see them people that are just 5 miles an hour, you know? But usually it is a little bit faster than that that has more damage. The more you hit, you see it coming, more injury. Because you see it coming, you tense up, you're pressing on the brake. You're at a stop sign and you see them coming, you tense up and you know it's gonna hit you. So really, nothing you can do with it, sorry. I know I put my phone in the back seat, okay? So it's definitely, a whiplash is going to be an acceleration or deceleration of your neck, okay? So what happens with that acceleration and deceleration of your neck is we take, remember my little can thing? Do I like props or what? Okay. So we have a ligament, right? Remember this is my ligament, it's stretchy. You're going to look at it, the chicken, it's the little white thing, okay? It was smaller in the front, way bigger on the back, okay? It's going to get stretched out, okay? And when we stretch out a ligament, it will come back a little bit, right? Does it come back to my circle? No, it's lax a little bit, right? It's not totally a circle, it's a little bit out. It's not going to be perfect when it comes back. Same thing happens with the ligament. The more damage you do, it gets laxed a little bit. People know this with ankles, sprained ankles. First time you do it, it's not a problem. Second, third time, your ankle's like just no support at all. And the ligaments are the support, okay? So with whiplash, which doesn't have to be a car, it could be coming up from a counter, you left the counter open, you come up, right? Someone's getting ice cream because they can't wait and you're in the refrigerator getting eggs and coming up. It definitely happens there, okay? We're seeing a little bit with airplane rides. You hit an air pocket, they come down, they're thrown back a little bit. So whiplash doesn't just always mean, and I think this 1 million is definitely probably getting higher and higher every day because these people are talking on those stupid phones. Okay. All right. So now, with the whiplash, it's a hyperflexion and extension. Okay? So what's going to happen? It's going to be a jolt going through your body. You're stretching out the ligaments, the muscles, the neck's going to tighten up. Usually in that type of injury, it's not going to be right away you have your pain because you're in shock of what's going on. It's the next day. It's something that needs to be checked out just to make sure there's no more damage. Okay? What happens is those muscles that we talked about are all going to shorten because they're going to be worked because that ligament stretched out a little bit. They're going to be all tight to try to help it a little bit, to protect it a little bit. We call it muscle guarding. It's too contracted. Okay? Things to prevent. When you get in your cars tonight, I want you to look at your head restraints. Okay? Your head restraints, sometimes I'll go to the person's car and I'll look at it, you know, and I'm short, I'm only 5'4". These people are 5'2", and they're down here and they're in their husband's car and the head restraint's up here. All right? Head restraint should be in about the middle of your head. Enough. You know, push your head back. It should be in here. It's not going to help you if it's up here. It's not going to help you when it's here because you're going to still go into that extension mode. Okay? So really important with that. We're seeing lately now with airbags, too. Okay? Shorter people, not the taller people that are here, but the shorter people, the airbag is great, but with the shorter people, they're getting thrown with their seatbelt on, they're getting thrown and the airbags are opening up and it's kind of forcing them back a little bit. So I'm finding it with just mostly shorter people. So that's another injury. But you're still better than not having a seatbelt or an airbag, or what could happen, you going through a windshield. Okay? So there's consequences for all that, but usually it's just the shorter people with the airbags injury too. Okay. Before I talk about the physical therapy part, which I love to talk about, before us, there's your doctor, okay? So this is how I always look at it. I always say to people, you know, you're gonna go, you have some pain, you always have to be checked out, right? You need to go to them to see your PCP, your primary care, your neighbor who's a doctor next door, I don't care who, okay? I like to think of doctors as mechanics. You would never go to the mechanic and say, fix my car. You would say, my car's making a noise, my car won't start. You're always giving them some information, correct? All right, so when you go to the doctor's office, you got to give them everything. Now that I'm teaching you what you have elbow pain, you're going to tell them you got elbow pain. You might kind of have to rule out the neck type of thing, okay? When they see you, usually what they do is when you first come in with some neck pain or whatever, they're going to give you some meds to try to get down the inflammation a little bit, do an x-ray. You're going to come back, you're still not better, they might do an MRI, which will show those discs. X-ray just show the bony part. MRI will show a little bit more in depth, the tissue, the ligament, see how everything's looking, okay? All right. They might send you to consult you to a specialist, a neurologist, a neurosurgeon, depending what they find on the x-ray or the MRI, or your symptoms that you're going to tell them, okay? All right. And then, we used to be a last resort. We're not a last resort anymore. We used to be, oh, just go to CPT, you can't get better. But we've moved up in the world in 25 years. They're like, go to PT, all right? And they can tell by looking at you a little bit, okay? When you come to PT, okay, at one of our 3 clinics, which we have Whitensville, Milford in here, so there's 3 of them, okay? We're going to do an eval on you, all right? We're going to ask you a million questions. We usually ask you a million questions before we even look at you. But we're looking at you, and we're already doing a part of our eval, okay? Like now, most of you sitting here now are kind of like, moving around, you're a little crooked, your head's on your husband's lap, you know what I mean? Like, I can tell what's going on, we can see whose shoulder's up, who's crooked. We're looking at you when we're doing an eval, okay? All right? So we're gonna do an eval, we're gonna look at your strength, we're gonna look at your range, we're gonna try to see, and we're trying to decipher, to see what's going on in your body, okay? So then we take all that information and try to make a treatment plan out of that, okay? The treatment we're looking at is what symptoms you tell us and what we see. Okay? And what most of it is going to be is trying to modalities, which we'll do on the little tour to show you some of those things, to get some inflammation down. You know what I mean? You got some swelling, we can touch you, we can feel some swelling in there, you're a little bit tender. We're going to use, we have like phototherapy, laser therapy, ultrasound, E-stem, we have electric stem. A lot of us are hands-on therapists who are going to be in there moving your joints around, see how that, if you're gliding or you're not gliding, that type of thing. And know what we're going to do? What's the next thing? We're going to do your posture, right? Because you're in your body 24/7, we're not, right? So the way you change your lifestyle, I just had one last week. Guy came in, severe neck pain, comes in like this. You know, this is a sign. Oh, he has, if anybody walks in like this, I know you have a herniated disc. So I go to him, I said, what's wrong? My neck hurts and whatever. First thing I ask him, where do you work? I always ask, where do you work? He works in Boston. You take the train? Yeah, I take the train. Show me how you take the train. He's like, show me how you take the train. Show me how you take the train. This is how he takes the train. Sits like this, and he's got a smartphone because he's answering the emails for work, right? All right. I said to him, this is what I want you to do. I want you to go to work, roll up your sweater, put it behind your back, smartphone, you get 5 minutes on. That's it. Get to work. Came back 2 days later, his pain was down 50%. He's like, you're right. You're right. It's my posture. All right. Very important to be aware of where you are, where your body is, where you're going to be. Okay. A couple things with posture is I always tell people if you have a partner or somebody else in the house or you're at work, tell a coworker. We're always like this. Remember that A posture? You're always forward. I want you to say, I always say to them, sternum up. You know, your bone right here. If you bring that bone up, you can feel your abs, guys. You get your abs back a little bit. I always say that. You know, you come up, you can feel a little bit in your back. So you want to be in an upright position. It takes 2 weeks. You're going to have some burning symptoms because you're going to be like, oh, I haven't been up here in a long time. Us short people, we need the height, right? We got to be up there a little bit. Okay. The head. The other thing with the head is we're always here. We lose the muscle here. This is the first muscle I strengthen in any neck patient I have because you're here. You have no strength. I'll have them lie down, bring the chin to chest. They can't even hold it there. It's like shaking like Jello. You know what I mean? Because this muscle holds you back. Okay. So then I bring out my toilet roll because I love my props, right? Toilet roll, really important. I bring it in every patient. Because when you're sitting, when you take off a toilet roll, you're kind of rolling over. Do you see that? You're coming up and over. That's where I want your neck. okay? I don't want you to be like this, no double chin. I want you to be up and over, just like a toilet thing. What comes up? Your sternum, feel your abs working a little bit, get a two-pack, all right? So up and over with the neck, just kind of roll, not straight back, because why do I want it straight back? You'll have that articular joint. Remember that joint we talked about, that you're gliding? Straight back, you're gonna shear it, but straight back and up, I'm almost doing a little traction in my neck. I'm lengthening those muscles in the back of the neck that give me a headache, okay? Toilet roll. Every time you go, think about me. Okay? All right? And the lifestyle changes. You know, buy a chair. If you're sitting in an old chair that has no back support, remember Nana, really short, I'm short. You don't need to buy anything. I need my legs on a stool when I sit because they don't touch the ground. If they don't touch the ground, I'm going to be rolled forward. You know what I do? I have the Globe, the Boston Globe. My husband loves the Globe. I can't get rid of the Globe. Can't go paperless with that. But I make it out of a stool. I'll take 6 or 7 weeks of it, duct tape it, and there's my little footstool to put underneath people's feet when they're at a computer. You don't have to buy anything. You got stuff. We have duct tape. I know we all have duct tape. We live by duct tape. Okay? Towel rolls. You saw the towel rolls in a pillow. You don't need to buy anything. Okay? Changes. Oops. Okay? So here's a little stool. When you go home, you know, I know even the monitors are disappearing now, which is making my job security awesome, okay? Because everyone's sitting on a couch with a laptop or a Kindle or an iPad. Worst position you can be in. And it's even funnier because here's their laptop, here's the game tonight, totally to the right. So what am I doing to that whole joint? You know, my muscles on this side are going to be tight, right? I'm looking right. I'm on my cap. But I got 100 friends on Facebook, right? The more you talk on that, the less you're going to have neck movement. Simple stuff. Don't be this lady. You know, be up tall, be up nice, okay? Look at that plumb line, what we call ear, shoulder. Where's my ear, all right? Gonna have that kyphosis, gonna look really ugly later, okay? Viewing straight, eyes should be up, okay? So if I'm here and my arms are resting, I'm not doing this. How many have tight neck muscles? Because you're like this on the computer, okay? I know I'm talking about a computer because that's the way today is. Okay? Really important. Look at her feet. She has a nice little stool. That's kind of nice. If you got some money, you can buy that one. You know? But my Globe does just as well. Okay? This way I'm not dragging. My feet are dragging. My trunk is going to be forward and my head's going to be forward. Okay? All right? Neck is important. Holds our brain. 15, 20 pounds. It's a lot. You need a good, strong neck. So when we come to physical therapy, we always give you homework. And I love giving teachers homework. It's really kind of good. You always get homework with us. The homework is going to be usually, I have a brochure out back with some exercises to do to help maintain and restore that neck to normalcy. Okay? If I look at half of you and your right side's really tight, you're all crooked, you're going to go home and look in the mirror. Am I straight or am I crooked? Okay? If I'm crooked like this, my right side's tight and this is overstretched. You need balance. You need balance in everything. Okay? It's important. People will say to me, if I have a neck patient who's like can't even move, is still in a neck collar, I want them walking twice a day, maybe 5-10 minutes. Because when you're walking, I'm getting your posture to stay in control. I'm getting your abs. I'm working your glutes. I want you to get out there and move. Okay? I don't want you to feel, you know, on the couch. 5 minutes isn't much. Then work yourself up. Because when I'm walking, I got to use my stomach. I'm using my glute muscles, and I'm upright. So that works pretty well. Okay. Any time of exercise you're going to do, you want to do slowly. Okay. Nothing you don't want to do. You don't want to do anything fast because if you do fast, it's crap. It's a waste of time. You know what I mean? It's crap doing it down here. I want you up. I want you toilet paper rolled, and I want you looking right or left. Okay. So whenever I have anybody stretching, I need to be in good posture before you even get that. Okay. You need the basic skills if you do anything. If you're golfing, you need the basic skills of golfing before you go out and swing. Same thing, you need good posture, and then you can do some exercises, okay? Really important. These are computer stretches, again, because a lot of people are at computer, and that's in the back also, one of the handouts for tonight, okay? I have to put a caution in anytime we talk about this, and I do it with my patients. Anytime I do give you an exercise or a therapist, or you try some from a magazine, or you try some from the pamphlet tonight, you always want to make sure you don't have any more increased pain or numbness or anything like that. It could be a warning sign, and you need to talk to your doctor. Okay? Don't push anything. Don't hold your breath. You want to be stretching. You want to get those lungs going. They relax the muscles, actually. When you're really in a lot of pain, you take a lot of deep breaths. Kind of relaxes you. My cute little giraffe. The thing I put the giraffe in, because how many cervical, we have 7. How many do giraffe have? They have 7. They're just very bigger than us. So I hope what I talked about tonight, you learned a little bit of anatomy. You're going to dissect a chicken. You know about a disc from a balloon. Every time you go to the bathroom, you're going to be upright a little bit, right? And that you're in control of your muscles in your neck and all. So, all right. I think we'll take a few questions before. Does anybody have any questions?
Does anybody have any questions?
Did everybody understand that a little bit? Do you feel a little better? You're all sitting up straighter than we started this, so that's a good sign.
John, I was about to start the game 7 minutes.
I know.
So I'm going to, there's Deb with the mic.
I just wanted to ask, you'd never mentioned scoliosis.
Didn't mention what?
Scoliosis.
Scoliosis, it's kind of that S-curve thing. So it kind of goes with muscle balance. And that's when we look at your muscles. So if you have a scoliosis for you guys, would be a curvature of the spine. So somebody will come in and they'll be a little bit curved. We try to catch them at a very young age when they're still growing. It's usually when the docs will show us. But we will see it in adults, and that will cause some of your pain in your neck. So we are always looking to get your muscle balance. So we'll do an eval on that. Okay, so usually you guys are good at telling us, I have a scoliosis history, and we'll know anyways, because you'll come in like this. You know what I mean? Say it again? S-curve is curly, yeah. Certain degrees, your doctor will tell you if it's scoliosis. Sometimes the scoliosis is due to where you sit at the computer or in your car. It might not be a bone dysfunction. You know, when you were growing up, it's because you sit like this constantly for 12 hours. So your curve's going to go that way. So that's why you get up and go for a walk and move some of the stretches. Did that help, everybody? It did? You're all going to be up straight? Sternum up. You're going to tell your partners if you're down, you're going to be up?
Yeah. Hi. What about dystonia with scoliosis?
The what with the scoliosis?
Cervical dystonia.
Oh, cervical? Important, the same thing. Is anytime you have a curvature, you're going to have a curvature in the neck to make up for the curvature if it's in your thoracic spine.
Yeah, I had Botox, but it didn't work.
It didn't work for the scoliosis?
For the neck and scoliosis.
Okay, all right.
So.
And the torticollis, probably, a little bit.
Hi, Gina.
Hi.
If you move your head or your neck a certain way and you get a shooting pain that goes up to your head, would that be neurological or would it be?
Well, it always needs to be checked out first, just to make sure it isn't anything that is vascular in your body or nerve in your body. But a lot of that will be that joint we talked about, that degenerative disc or arthritis, or if you pinch it on the disc a little bit. Yeah. Very forward heads will have that, shooting up.
Just certain times, and then it shoots up, and I can't move because the pain is fierce.
It's a deep pain. It's a deep ache. And a
and
lot
then
of times,
it'll go away.
Yep. A lot of times because you have the very forward head in that position, so we need to get you up and moving a little bit. And that's where your muscle balance are off a little bit too. So that does, you're welcome.
Your cervical pillow that you showed us, it has 2 dips, a smaller one and a bigger one. Does it matter which way? Is it a comfort thing which way you put it for your neck?
With the what? With the
cervical pillow that you have?
Oh, the pillow. No, you sleep naturally. I don't want to fool with your sleep. So it can be whatever you're comfortable. It can be.
Side?
Yeah, it doesn't matter if it's this side or this side at all. It's what you would normally sleep. If you're a right sleeper, most people sleep in the same position, or they toss and turn at night. But it's made to be right, left, or on your back. Oh, the disc doesn't matter. No, that's not going to affect it.
So the angle of the pillow, one side's like a bigger dip.
One side's bigger on this pillow than little. That's why I like you to try with the towel first.
Oh, okay.
Because the towel, you can unwrap it a little bit and make it to the size that you're comfortable with.
So that's why one side's bigger than the other side?
On my pillow it is, yeah. I use the smaller side.
Oh, okay.
But sometimes my husband throws me off and throws it the other way when he makes the bed. Yeah, but I know as soon as I lie down on it. Okay?
But you could turn it around if you're more comfortable on the other side?
Yes. Mm-hmm. One side's bigger. Some aren't. Some are both sides. Some just have the one and not the two also. Yeah.
Do you recommend taking like a Motrin before you start these neck exercises? Take Motrin before you start doing these exercises?
I don't know. I do recommend like a hot shower. I think Motrin's great. I wish I invested it and put some money in it a long time ago because it does a big cure-all. I don't want to mask your pain when you first start out doing them. I want to know if you have pain doing them, I would say. Would you guys agree with that? Yeah.
Maybe stretch it or do something.
Yeah, like I said, you always want to start off gentle. You don't want to start off going, you know, I always tell people when you turn your head, look at the wallpaper, you know, take a breath, relax, come back. You want to go the same side because that's warmed up, you know, and then go to the middle and then go to the opposite side. So when you come to the end, you want to take a breath and then kind of stretch a little bit. Everything is slow and relaxed with the neck. You don't want to hit that gliding joint. You want to go slow.